All right, guys, I'll show you how to do a short leg splint. The goal of this splint is to immobilize the ankle joint at 90 degrees, so essentially neutral dorsiflexion. So we'll get into how to get that positioned. First, let's go over our materials. Make sure you have your bucket of lukewarm water, about 6 rolls of 4-inch web roll, 6 rolls of 4-inch plaster, a 4-inch ace, a 6-inch ace, and then plus or minus a Curlex roll, depending on if you have an assistant or not. So first, let's measure out your plaster. The first component of your short leg is called a stirrup or a U. Essentially what you'll do is position it on the base of the foot like this, and then have it extend up to the knee on either sides. Again, you want to try to measure your plaster a little bit longer, because once it starts heating up and drying, it's going to shorten, and you don't want to lose length on your plaster. Second component is called a posterior slab. Essentially, you want the end of your plaster to end at the metatarsal heads, and then proximally extend up to the knee. So as far as positioning of the ankle, if you have an assistant, they can help you. But the goal is to make the ankle at 90 degrees. So what I would do is, if you have an assistant, have them hold their elbow sort of in the crux of the knee joint there to bend the knee to 90 degrees. That's going to relax the gastrocnemius muscle and allow you to get some more dorsiflexion on your ankle. And they can hold this position while you wrap the leg. If you don't have an assistant, you can use a Curlex unraveled, just like this, and essentially wrap it around the toes. There we go. And then give it to the patient. And your knee bud. And have them hold it towards their opposite shoulder. So that way, have their knee bent 90 degrees, ankle bent 90 degrees, and they can hold it themselves while you're wrapping. So I'm going to leave you like this if you're okay, Raj. Go ahead and start wrapping. So again, you want to make sure you're padding the bony prominences. So I start at the metatarsal heads, pad that about 3 times or 4 times to make sure I have enough thickness. And then I'll start traveling about 1/3 of the distance of my web roll to make sure I got enough coverage so I don't burn our patient here. Come back around the Achilles. Always kind of be checking in with your patient, making sure they're not falling asleep on you, or make sure you still have your right orientation of your ankle. So we got plenty of dorsiflexion here. Once you get to the top, right about where the fibula neck is, you want to pad that. You want to pad your common perineal nerve about 4 or 5 times. Make sure that when the plaster rests there, you don't get a nerve palsy. And then I kind of come back and check and see where I'm thin. And just like with a sugar tone, what I do is I pad the heel and the Achilles tendon real well. So I'll pad the malleoli and the heel just like this, once there, once on the bottom of the heel, and then once over the Achilles, just like that. And I'll do that 3 times. So again here, 2, 3. If I start losing my soft roll, I can kind of wrap it and hold it in place. 1, 2, and then last one, 3. I'm gonna take this and just wrap everything. Keep it nice and snug. You wanna make sure you have no wrinkles, no step-offs, because those can cause pressure points that can cause skin necrosis at the end. Last, just check and see if I'm thin any places. So I'm a little thin up here, so I'm gonna rewrap. There, that looks pretty good. Again, making sure my ankle's dorsiflexed, my knee's at 90 degrees. I can go ahead and dip. First thing that I dip is my U. Go ahead and dip it. Give it a good squeeze. Wring it out. Once or twice on each side.
What in the heck?
And then once you have it wrung out, sort of position on the leg like this. If you don't have any help, you can rest it on top of the leg here, just like that, and then reposition as you wrap it. So for the short leg, I like to kind of tack it down at the ankle once, and then reposition my plaster on the medial and lateral aspects of the leg. You all right, Roger?
Yep.
Good. Perfect. So once I got my U positioned, I'll get my posterior slab. Bring it out. Now positioning here is important. Come on down, bud. You want this to rest right at the metatarsal heads there. And then here, you can kind of follow yourself up the leg. Once you got it tacked down, just like this. Make sure you get a decent mold at the heel. There you go. Sometimes your assistant can help you with your plaster. And again, at the end, make sure your plaster's not touching the skin. Make sure it's got good web roll cover so the skin's protected. Take care of that. Now, I take the 4-inch first, wrap the foot, taking care to keep the toes exposed. And then usually you have a lot longer distance to travel, so I use the 6-inch for the upper ace. And again, once you dip your plaster, it starts drying, so time is money, as they say. So I kind of try to be quick with this step. If you have an ankle fracture, all right, go ahead and let go, Raj. I'll take the leg now. What you want to do is keep the leg at 90 degrees to relax the gastroc, and then use your chest to kind of push and gain some dorsiflexion on the ankle, just like this. For bimalleolar ankle fractures, you can sort of take them both together and squeeze like that. If you have an ankle dislocation, you can give it a valgus or a varus mold depending on where the direction of the deformity is. But essentially, this is your mold here. You can ask the patient to kind of push on your chest a little bit. That'll give you some extra dorsiflexion that way, and then you're given a little bit of a bimalleolar ankle mold like this. And then while I'm sitting here, I'll sort of tuck in the ace and make it look a little prettier, just like that. You know, Roger having an ugly splint where he can't continue his modeling career. And that's it. That's a short leg splint.